You had a good lunch, and I don't put you up to sleep again now. So today morning we had a very nice presentations with doctors, and they were specifically speaking about cost savings and process improvement. I think I'm also going to said the same things, the same stage, but in a different direction from the more of a supply chain point of view with respect to product sales. So we are going to speak about efficient procurement strategies for hospitals. And the topics which we are going to touch today are how procurement is changing the healthcare, what are the limitations of conventional way of procurement, and how BisVani is making this current scenario. And many of the hospitals, when we speak, they say they have their doctors as the procurement specialists. They have a bigger work to, they have a bigger job to do. They have to take care of the patients, but they get into the procurement process. This procurement process requires a certain kind of taking up a couple of products from multiple suppliers, comparing the products, comparing the prices, comparing the quality, comparing the specifications. This requires a diligent process, but when doctors do, I think it delays the process. When it delays the process, and finally, because of too much of work stress, they may not do the right job, and they may end up paying more, and they may end up not picking up the right supplier. So these are the problems which comes through when doctors become the procurement managers. Now, we as BisVani, who is like, we are a marketplace for healthcare products and services, we try to help these hospitals to solve the problem in procurement. How procurement is changing in healthcare, like how it is currently changing, that too post-COVID. It's been like a tremendous change in the procurement process, and healthcare is one of the biggest sectors when compared to any of the sectors. You take food sector is second biggest, and automobile sector, any of the sectors, healthcare sector is most critical, biggest sector in the world, and it is most unorganized sector in India. Basically, all its processes are most of the mid-size and small-size hospitals have got all these processes disconnected, where the decision-making, basically when the data is not connected across, the decision-making and bringing out right purchase decisions may be difficult here. Okay. This is the current decade. Current decade is for healthcare transformation, like IT in 90s. IT went through a huge change during 1990s, and that particular decade was like a watershed moment for India. At that time, it was a huge IT revolution. Now it is going to be health IT revolution coming up in this particular decade. And also, it is not just with respect to the procurement process, it is also with respect to the products. When it comes to the products, there are many new products coming into the market which can actually replace the old technologies and which can actually provide you a better price and better efficiency and less stress from the healthcare providers. That kind of a change is coming through the healthcare industry, and it is apparent for all the doctors and hospitals to look through this kind of solutions coming through, such that they can replace their existing solutions, or they can they understand first, even before replacing these solutions, they need to understand these particular solutions such that they can have a different kind of a solutions, and they are not lost in the marketplace, or like in the market of healthcare. One of the most critical aspects of transformation in healthcare is procurement machinery. See, when it comes to the procurement machinery, when it comes to the consumables, or when it comes to the equipment and all our drugs, it roughly goes around 34 to 35% of the whole expense of the hospital, and this is a quite big chunk, okay, when it is handled quite efficiently, but it is a very supportive place also, because without the proper procurement machinery, the actual products available to serve, like either consumables or whatever it is, with respect to hospital consumables, if it is not available at the right time and right amount of quantity is not available at the right time, it will directly impact on their service, and the doctors may not be able to serve the patients properly. What is happening right now when we say that digital technology is coming into picture, they're actually bringing down the workflow of procurement process. That means like multiple layers, multiple checking of multiple suppliers, multiple products. When it can be thrown up digitally, when the products can be directly compared, when the suppliers can be directly compared, the values can be directly compared, and the number of layers in the whole supply chain can be brought down, the hospitals will ultimately get this kind of services on their fingertips, and they can actually make a best buy, and we as a marketplace can actually give them, take away their overhead costs also, such that for example, if they have to have a procurement manager, or if they are going to have doctors as procurement managers, then in case of doctors as procurement managers, you are taking away their very, very crucial time, which they have to take care for the patients, and putting into this process. And when it comes to other procurement managers from outside, you're blindly depending on them whether they are going to give you the right output or not. You're not sure until your pocket is actually pinched. So that is that is where our marketplace will come into a place where it gives a transparent system to the hospitals, where they will be able to openly compare the products, they openly compare the specifications, openly compare with respect to the prices, and see their performance when it comes to other places, how these particular products have performed. And based on that, they can make a quick decision, and it will be a more informed decision and more trustable decision, rather than just depending on the people. When it comes to COVID-19 has highlighted the lack of systems, data integration. When multiple systems, like the demand, supply, everything, they have to work integrated. When they are not working as integrated system, then there are a lot of cases where there will be the loopholes, where the information, there may be some ask, and there may be something else supply, or may not be supply in the right time. That may create a lot of issues. And we have also seen about just-in-time supply chain model that has got broken during COVID situation, when there was a huge jump for requirement of certain kind of consumables like PPE as well as ventilators and all that. If we don't have multiple suppliers and we don't see actual demand, how the demand is rising, proper segregation of the supply with multiple suppliers cannot be done, and there would be imbalance between supply and demand. This can be, I won't say it can be eradicated completely, but to a very large extent, if there is a proper demand is being identified, the supply can always be managed. People can always plan for the supply. Yeah. So I have already spoken about limited inventory visibility, and also with the when it comes to the limited inventory visibility in the hospitals, there are a couple of products when it comes to healthcare that can be expiring, that can lead to the wastage, and there are a couple of products that are required, which are critical, and they will not be supplied in the right time. Those are the things which can be brought through, can be an issue with limited inventory visibility. And siloed processes is again fragmented processes. Every department works on its own way. And for example, when I go for a hospital, if I see that, I get medical record in every hospital, okay, every new hospital. And if I go to a new doctor, he asks me to get the medical record. How about the previous hospitals where I have visited, where I have got the medical records? There is no track of record that way. So whatever the doctor treats, it may be just based on the previous record. So it is not a complete solution which we are bringing through. So this kind of like integration of systems is very, very much required, such that proper decision can be made on the patient's health, and the patients can be treated. Again, I was speaking about the procurement and distribution models. I will speak more further on these models moving ahead. Okay, as I was speaking about, how much 30 to 35% of the cost goes to healthcare product procurement. So the consumables, equipment, and drugs putting together is 30 to 35%. That's a major chunk. Okay, one of the solutions when we speak about procurement is centralized procurement. When you how can we say that no, these corporate hospitals still make a very good money, still make very good very good decisions? How does that work? Because they have lot of processes being set, which is not available for the mid-size as well as the smaller hospitals. They have procurement process, they have inventory process. All these processes are automated and in a larger scale. So that gives them higher visibility and that gives them higher capability to manage, and they can reduce the prices. You know, corporate hospitals might be buying the same stuff with a lot lesser price than the smaller and mid-size hospitals, because they negotiate the price. They have a visibility of multiple sellers, and they buy in bulk. They may directly buy from the manufacturers also. So that will actually bring down the cost to the corporate hospitals. But this facility is not available for a mid-size or a small hospitals, because they're doing firefighting every day. They cannot set the processes. Specifically, when as a marketplace, when we enter as we take away their pain of procurement process, and we give them the best suppliers, we give them the best cost, we give them the alternatives in case of there is an alternative, and it's of best price, as well as it's of sorry for that. It's of the best price, as well as, you know, it comes of best quality. And there are so many alternatives that are being manufactured in India that are commanding better price, that are commanding same quality. Those can be used as an alternative. So these things can be done, that is been done by the corporate hospitals, but this visibility as a marketplace, we can also provide that. We are taking, not just we are taking away the procurement process, procurement headache, we are taking away the pain of making the decision also. So this helps one way. We also provide them an opportunity to reduce their procurement overheads. Yeah, that's what we were speaking about. Benefits: one is better products, quality, various products available in the market, substitute products. That's what I was speaking about. Lower prices due to economies of scale. Maybe based on the shelf life period, they can actually go with the better products, and they can buy on the huger quantity based on the requirement also, the need also, and lower overhead costs, which I was speaking about, and easier procurement process, that best prices, variety of products, and quick access to the products is what, as a marketplace, that can be provided. What are the limitations of the conventional way of procurement? So as I had spoken about earlier also, we are working in silos, and doctors are acting as a supply managers. These are quite number of issues, and COVID-19 has highlighted in sharp relief of inadequacy of current models, and has forced providers to rethink how their supply networks are configured to build resilience and localized value chains of critical products such as vaccines as well as PPEs. Limitations: need for greater efficiency in order to keep up the demand. Improving efficiency or reducing wastage leads to saving healthcare budget. This, as the budget, healthcare budgets, we pass on the savings to the hospitals. They will be able to invest in other areas such that, you know, they can provide better services to the patients. Need to prepare for future global outbreaks. As per our Bill Gates, he says that the there are a few more pandemics that may break through in another 5, 6 years. There are more pandemics to come. So it is better to be prepared for it. So for that, we as a marketplace will help on that side. COVID-19 has great example for us to understand how unprepared we were not. We were not just in developing countries, but also medically advanced world. Even advanced world had this problem. Challenge of reducing costs while maintaining quality and care. Again, there will be multiple suppliers for same product with different prices, or product with varied specification and respective prices, which makes the decision making very cumbersome, time-taking, and also you may not have an idea whether you are getting the product at right price and quality or not. So this is the other limitation which we have. And for any informed decision to be made, how corporate hospitals do better, and how these mid-size as well as smaller hospitals lack in these areas is because of data. Data is one thing. Most of these hospitals are being automated. When it comes to the corporate hospitals, they are automated and their data has been linked, and they will be able to make quick decisions. And this next decade, what I'm speaking about healthcare, it is more of a health tech era where, you know, data plays a huge role. Data will be playing a huge role. When you're keeping the data in files, you're keeping the data in records, in paper records, you'll not be able to get access to those data easily. That will create, that will not allow you to make certain kind of analysis what you have to deal with people. One is lack of reliable data for analytics, forecasting and planning, inefficient inventory management and wastage due to poor visibility of data, lack of compliance and accountability, and manual processes with paperwork and unorganized media. Unorganized media like CDs and other equipment which you don't, you keep haphazardly, that will not help them to make a right decision. And also it creates supplier dissatisfaction. For example, you find a good supplier, but you're not making the payments on right time, or you're asking maybe irrelevant questions and all, or you're not, there is no proper onboarding process at all to the supplier. That would create that would actually create dissatisfaction among suppliers. Other very common medical procurement and supply chain issues is outdated technology. Many healthcare facilities rely on inventory tracking and management systems that are old and outdated, which can lead to significant deficiencies or errors in the procurement operations. This also requires an integration with maybe the central procurement and all. So if these technologies is not been updated, this will also be an issue. And also with respect to devices, if there are outdated technology, new technologies that are coming through. So yeah, new and efficient technologies, cost-effective technologies are coming through. If you are not replacing it with the right technology, that will also create a problem. And provide a personal preference bias. Again, when you are going as a hospital and you believe one particular guy supplier, that this guy is doing a good job, or you have some relative whom you depend on, but you don't know what are the hidden costs he's hiding, and what are the service costs he's hiding, and what are the service costs you're you're blindly believing, as a hospital, you're blindly believing one kind of a supplier or one kind of a relation, so you may not end up with the right price as well as a product cost. Variable product costs and service costs, custom products and services which are often required for highly specific and unique applications come with higher cost and standard solutions. These are custom products. So again, you need to look for some alternatives. If you have the custom products and services, you cannot command for the better price there. It is specifically. And supply shortages. This is like supply shortages, I already spoke, and COVID-19 also has highlighted this issue where there is supply shortages. So you need to, in kind of supply shortages, that's what I was speaking about, demand and supply difference. If that can be balanced, this issue can be solved. Again, hidden cost is what inventory costs, purchasing price, as well as the cost of shipping and storage. Additional and any excess supplies that expire reduce cost efficiency and health of the healthcare facility. Again, I was speaking about the shelf life period, how if the shelf life expiry happens, how it becomes a loss to the buyer. How BisVani is making this process digital, like as I was highlighting earlier also, it is marketplaces which are making this process digital and actually taking away the taking away the pressure of procurement process as well as the overheads on that side. Give me a second. Excuse me. Speaking about RFI over RFP, RFI is, usually you see the RFP where you know certain kind of products, you go to the marketplace and you only look for those particular products. This is what you know, but what market offers you, okay? When it comes to what market offers you, you need to understand there are new alternative products, many alternative products that are coming in the, there are many alternative products that are coming into the market, and there are alternative solutions that are coming into the market. When you are going through the marketplace like BisVani, you will actually look for other alternative solutions, okay? That is request for information. You go and look for the information, and you can have a choice to buy alternative product. There are many innovative solutions that are coming up in the market, specifically when it comes to the Industry 4.0 solutions, like AI solutions. There are IoT solutions. There are 3D technology that is coming through. There are a couple more solutions with respect to genome sequencing. Many new solutions are coming into the market, which will actually give far more clear picture about the health conditions, and far more economical solutions for which can be offered, like, which can be utilized by multiple people. So, like, which for lower economic people also. So those kind of solutions are coming through. And if you are only stuck with the old way of using certain kind of products, you may not get that kind of a visibility of new products coming through the market. So marketplace like BisVani can actually bring through visibility of those kind of products. This is our marketplace, and this was a couple of solutions which I was speaking about: robots and IoT device, AR, VR equipment. This is one of the cognitive healthcare training equipment which we are speaking about. Again, 3D technology, it is making a revolution in dental surgery. So these are quite new. These are few examples which I'm speaking about the new technologies coming into healthcare industry, specifically on the hospital side. Cycle time reduction, that's what I was speaking about. In general, healthcare contracts were originally designed for very different business models, with long-term relationships being the norm. However, as digitalization progresses, there will be need to significant reduction in the cycle times of transactions, which can lead to high level of flexibility. That's what cycle time reduction, when usually there was no clear information what product comes at what price, and these kind of, and how many suppliers. That was not there earlier, but now marketplaces coming from with multiple suppliers for the same product with a different pricing, and even with when you are buying in bulk, the price will be hugely reduced. That will also bring down the, how the price can be reduced is the manufacturing process also will require lesser time for the products to, like, it will have lesser resources, and when it comes to bulk manufacturing, it becomes for them a higher, bigger order, and they can reduce the cost of manufacturing. When they reduce the cost of manufacturing, you'll get on the better prices. And cycle time reduction happens because you have multiple suppliers and you have transparent data in front of you, which will make you to take a decision quite quickly, and you will be having a clear decision, and you can compare the products and you can buy easily. That's how you can reduce the cycle time. Supply satisfaction also, it is a quick answer, and suppliers also have they also have a multiple channels to sell their products, and that's how they come with the supplier satisfaction. With transparency on orders, payments, and contract, supplier satisfaction reaches to the new heights. That's again the supply satisfaction. This one. Then data-driven fact based on decision making. I had already spoken about data-driven fact because everything is transparent. Most of the information is transparent. What is your logistics price? What is your product price? What are the different suppliers? What is the product specification? How each product is different from each other, and in the same kind of a product, what is the variation, and everything, whatever you need, it is specifically available here. So it will be a more clear decision making. Compliance, again, healthcare has to be compliant. Improved processes and automation result in better compliance with industry regulations. So that's another thing. Optimized cost and increased savings. Again, when I was speaking about procurement is most of the cost to the company. Once either you can make profits in both two ways. One, you raise the sales price. The other one is you reduce the cost. So we help in reducing the cost and increasing the savings, so that you can, however you want to use, you can move on to that, whether you want to keep it, pass it on to the patient, or you want to keep that is left to your decision. Okay. Other one is importance of balancing supply chain risks with commercial consideration in different situations. We are going to talk about two cases. One is high risk, high value case, and the other one is low risk, low value case. And in this one, which areas and how many suppliers you need to have in each of these areas. One is like specialized use, and in high value, high risk area, the specialized use, clinical preference, the staff is trained on set of specifications and models, and in unique life-saving items, if it is not available, no other product can replace their functions. And another high-risk area is like limited or complex global supply. If the supply defaults, it would be difficult and timely to find the alternatives. For the example, it is biosimilar drugs, surgical tools, and implants. In these cases, you minimum need minimum of 3 suppliers or more suppliers, such that your function, the hospital function doesn't fall in risk. So these are the norm which you need to have at least 3 or more suppliers. When it comes to low risk and low value commodity, like several sources of supply is available, so if not, there's something else, nothing to worry on that side. Interchangeable if you can use an alternative, and basic or standard technology, easy to produce. Simple supply chain in case of new supplier has to be identified. That can be done easily and easy to use. Staff is comfortable with different models, no training is required. In that case, like generic drugs, gloves, and cotton swabs, you need to have 1 to 3 suppliers. That would do, because other suppliers are readily available in the market, and there is a huge amount of supply in this area. So these are the norms for high risk and high value, as well as low risk and low value areas for products in case of any vendor default. So that was about a couple of efficiencies, how we can improve on your procurement process in hospitals. And clearly, the message is like, if you're a mid-size or a smaller size hospital going through the marketplace for procurement of your products will actually give you a lot of savings. Thank you. And this is my contact.